Yes, I've asked you to watch this film about trigger finger release so that you understand fully what's going to be involved when you come in to have your operation to have your trigger finger released. Trigger finger release is a very successful operation with very few patients having any problems following surgery if all goes well during the operation. The vast majority of patients, 90% of patients, are very happy with the outcome, and the 10% of patients who aren't happy with the outcome are unhappy for the following reasons. One is they've had a bit of an infection and the wound is a little thick for a few months. That usually settles down uneventfully with antibiotics, particularly when the stitches come out. Some patients are unhappy because there's some altered sensation down the border of the finger, but we do everything we can to try to make sure that you don't get a nerve injury. Some patients will have recurrent triggering, but that's extremely rare. And some patients will have a slight weakening of grip strength secondary to the thickening of the scar from the operative site. But generally it's a very straightforward operation, and most patients recover a full range of movement within a few weeks. When you come in for a trigger finger release, this will be performed most often under local anaesthetic unless we're doing multiple fingers. If we're doing this under local anaesthetic, in the anaesthetic room we'll infiltrate the area of the surgery. This takes about 5 minutes to work, and when it's working we'll then check it, and then when we're happy with that we'll go ahead with the surgery. We'll chat during the procedure. You'll have a tourniquet applied to your arm, which is quite tight for about 10 or 15 minutes while we do the operation. We paint your hand with some antiseptic, put it out on the arm board, and then cover you with surgical drapes. We can chat during the procedure. We'll make sure that you can't feel the area of the operative site. The uncomfortable part of the day is wearing the tourniquet for 10 or 15 minutes, and that just feels like a blood pressure cuff. The surgery is usually very straightforward, and once that's finished, we'll put a bulky bandage on your hand. We'll show you the dressings as they go on. You'll have a little sticky dressing over some non-dissolving stitches. The stitches come out at 2 weeks following trigger finger surgery, and you have a sticky dressing over the top, and then a wool and crepe dressing. That covers the hand, but not the fingers and the thumb. And I want you to make sure that you can do your full range of finger exercises, thumb exercises, and make sure the wrist doesn't get stiff following your surgery. After an hour or two, you'll feel well enough to go home, and we'd like you to go home with an escort if possible. You have something to eat or drink to make sure you don't feel faint in your return journey. And during the first 24 hours, you'll take painkillers as necessary. Many patients don't require their painkillers at all, but some patients will take some painkillers during the first 24 hours. I'd then like you to reduce your bandages at 48 hours. Just take the whole thing off, and you saw me putting them on in the operating theatre, so you'll know exactly how to take them all off. And then you have a sticky dressing underneath the bandages. You can take the sticky dressing off and wash your wound in normal soap and water from 72 hours. Prior to that, it tends to be a little moist and can bleed, so it's just a little easier to wait until 72 hours before you wash your hand. Then you can use your hand as comfort allows, and remember to do your exercises 4 times a day for about 5 minutes to make sure your hand doesn't get stiff. I'll then see you in the clinic at 2 weeks to take your stitches out. Many patients will return to work within a few days. If you have an operation on a Thursday or Friday, it'd be realistic to return to work on a Monday. It is a little uncomfortable for a couple of days, so it's unrealistic to think about going back to work either the same or the next day. And by 2 weeks, almost all my patients are back at work. Fortunately, following trigger finger release, complications are very uncommon. If you do have any complications at all, the most likely is mild infection around the wound edges, and if you have a little bit of redness around the wound edge, then you may have an infection, in which case some antibiotics may be indicated. But that's just a few percent of patients will have that problem. Other problems are that patients feel that their hands are a little stiff or swollen, and a telephone call to my secretary or to the hospital, and we'd be happy to have a discussion about that. And if necessary, I'll see you more urgently than the usual 2-week follow-up appointment.